Okay, so now I'm going to do vital signs on the patient. So the vital signs, you check temperature, blood pressure, respirations, pulse, and then you do the pulse ox, which is the oxygen saturation in the patient. And normally you would just put the pulse ox on the patient's finger. It'll read how much oxygen they have in their body. And normally, for a normal patient, if it's reading like 95 or higher, that's good. But if it goes below 95, then you might need to give them some supplemental oxygen. Okay, so for my patient, I'm gonna go ahead and check her blood pressure. Okay, so most blood pressure codes have the little line to tell you where to line it up against the artery. So you just put it on them. And you want to make sure it's tight, but not too tight, so that you can get a good reading. You want to have the patient relax their arm. Okay, so when you take the patient's blood pressure, you want to listen to their brachial pulse and just put your stethoscope on there while you're listening. Okay, so my patient's blood pressure is 120/75. And then you want to, when you're checking the pulse, you want to take the radial pulse. And you can check the patient's pulse and listen to their respiration. Watch their respirations at the same time. Okay, so with respirations and pulse, you can do 30 seconds times 2, or you can do 15 times 4, or you can do it for a whole minute. So you just want to watch for respirations, which is the rise and fall of the chest. And then you can count them on, keep track of the time on your watch, or if there's a clock in the room, you can use that. And then that's how you do vital signs. And then when you check the temperature, you want to do oral temperature because that's the closest to the core temperature, unless you're doing rectal, and you only do rectal when it's required. But if the patient can't give you an oral temp, you can go under their arm. Most of the time for like babies or children, you do it in their ear. But that's how you check vital signs.